Hello, everybody. Welcome to another episode of What's Next After BDS edition, Royal College of Surgeons. And today I have with me a special friend, a friend since I've known in the age of 2010. Yes, that's the first time we met. My BDS classmate, Dr. Gyaathri. She's from Malaysia and she has recently completed her membership exam for the Royal College of Surgeons, Edinburgh. I hope I pronounced it correctly. So, Gaya,
Thank you.
it's Gaya. Dr. Gyaathri, can you please give a short intro about yourself?
Right. So my name is Gyaathri, and I'm from Malaysia. So I graduated in the year 2015 with VINAY. And after that, I proceeded to do my compulsory government service for about a year. And in 2017 is when I gave my MJDF Part 1. And then after that, the progressing 5 years, I had worked as a private practitioner, private dental practitioner. And during which was when I sat for my Part 2 MFDS last year in September 2022.
Yeah. So MFDS stands for the member of the Faculty of Dental Surgery, Royal College of Surgeons. So we have basically 4 Royal College of Surgeons, if I'm not wrong: Ireland, Edinburgh, Glasgow, and London. So today we're going to specifically talk about only about Edinburgh and its preparatory process. So, Dr. Gyaathri, can you please briefly tell me as to yes, before there is a concept of MJDF, which is currently not there. So, which is about 5 years back. So today, students have to clear both Part 1 as well as Part 2. And do you know something about the current format of MFDS Part 1?
Okay, so since now the manner in which the exams are conducted have changed. So the MFDS Part 1 is now being done as an online version. So the way the questionnaires are set is basically the same. It's 180 single best answer questions, if I'm not mistaken, and over a period of 3 hours. So you know the time frame that you have in order to attempt all of the questions. Some people may actually feel that this time frame is slightly shorter, but definitely, there are lots of courses that are conducted to guide you through how you actually go through all of these questions. But basically, since it's an online sort of an exam, the only thing that they ask you is that you have a well-lit environment and you're in a comfortable environment where they can hear you well and you do not have any noise interferences. And also they'll ask you to check a few other things. So they have their own guidelines and format as to how to program your computer and to check for certain things before you sit for the exams, because they want to know that the exams, when they're conducted for you, is being conducted fairly. Exactly. So they want to know whether, you have proper internet speed and you have proper RAM and all of that. And so that's a little bit about the MFDS Part 1.
Okay. Yeah, exactly. So, and MFDS Part 1, like you said, the exam format is for 3 hours, so 180 questions and single best answer. So it's not going to be where one question can have more than one correct answer. It's like the typical Royal College format. Now, I have 2 queries in this. What about the syllabus? Is it going to be only clinics, or is it going to have some components of basic sciences? And do you have some scenarios where you have to, read the question, and what are the various types of questions you can be asked? And do you have negative marking? This is the other question which I wanted to ask.
Okay. So when you're attempting the Part 1 exams, now I sat for the MJDF Part 1 exams. So my guess is that when it comes to MJDF Part 1 and MFDS Part 1 exams, it's somewhat similar. The book that I mainly used when I was studying was the Oxford Pink Book, because a lot of people stress on reading all of the important points in the Oxford Pink Book. I think a lot of people find it a bit challenging when they look at the whole Pink Book and they're like, oh, how do I complete this? How do I remember the whole textbook? So now the idea is actually not to remember the whole textbook. Yes, basic sciences are there. But unlike other exams that you come across in other countries where critical thinking is also a part of your question, they're not going to ask you an entire scenario in your questions for MFDS or MGDF Part 1. So what they basically ask is, for example, if they're going to ask you all the questions that you've completed from your first year till your final year. So it's basically information that you already have in your mind, in your memory.
Okay.
And I can give you a rough example. So how a single best answer question would be like this. So for example, let's just say they're asking you a pharmacology question, and then you have 4 different answers, okay? And all of these answers are somewhat the same. So now what they mean by single best answer is that what is the answer in which they want you to be able to answer that particular question in the best manner possible, that you know that you have read according to their guidelines.
Okay.
So the answers can be very similar. So the manner in which I studied for these questions was because they're quite repetitive in nature. So I downloaded this past test online. So they have they revise their questions constantly to update the most recent list of questions that they come out for your exams. And this past test online is very, very helpful. It basically gives you an explanation for every single answer that they've given you. Although your answer may be right or wrong, whichever answer that you've selected, they give you an explanation for that. And they give you an explanation for all of the consequent answers that are also wrong. Why this answer is not the best answer. Yeah. So that is a little bit about part 1.
So there's no negative marking.
There's no negative marking, yes. So there's no negative marking in MFDS part.
And like you had said earlier, online exam is just going to help you save your accommodation and travel fee. And maybe you're going to be a little more comfortable by writing the exam in the room of your choice.
Yes.
Otherwise, the protocols are the same. The standard of the exam is same. It's not that online is going to be a little more easier. I 100% agree with and also all these colleges have an inter-speciality option where when you do an MFDS from one exam, you're eligible to write the MFDS 2 of any other college also. And also you have a period of 5 years before which you can take the MFD 2, right? Am I right?
Correct. Yes, you have a period of 5 years from which you complete your MFDS part 1, and you have that 5 years to complete your MFDS part 2. So now if you don't complete it within that 5 years, your part 1 becomes invalidated and you've got to resubmit all of your documentations and transcripts in order to sit for the exam again.
Assuming some candidate attempts the second part and is not able to clear it in the first attempt, does he have another go at it? I mean, what is the time limit or number of attempts with respect to attempting the second part?
That's a very good question. Okay, the number of attempts, I think I might have to read the website again because I'm not entirely sure. But yes, you do have a certain number of attempts that you can try the part 1 exams before you sit for your part 2. But the idea is that, once you've actually written your part 1 exams, or for example, even if you don't make it, the idea is to try again until you succeed before that 5 years gets over. Yeah.
Okay. These exams are quite expensive, so make sure you give your best preparation. Although I think in my personal experience as I'm training students, it's not a difficult exam, but with one exam, which requires a lot of focus and attention. You need to be in that groove for those 2 or 3 months when you're preparing for the examination, right?
Yes.
Yes. And moving on to the second part, which you had recently written. So can you briefly go through your preparation, the exam format, and how it was to, giving the exam? What are the difficulties or challenges you faced?
Okay. So the MFDS Part 2 exams, I'll touch a little bit on the format first. So the MFDS Part 2 exams, it's divided into a few stations, and you will have about 10 stations, okay? And each station, you will have about 2 minutes to read your question, after which the bell will ring, and then you have to move into the area where the examiner and the active patient is. And they give you 8 minutes to discuss whatever the question is asking you. Let it be communication. They'll assess you based on communication, but yes, it's going to be a little bit about history, your management, your treatment plan, your diagnosis, and all of that. So that is the basic format. Now, they do stress in the MFDS website that they do give breaks in between, like 2 rest OSCE stations. 2 rest stations in between all of your OSCEs. But when I was writing the exam in September, since COVID happened sometime in between, and I was the second batch to do it face to face. So now they had to accommodate a lot of students. We didn't really have a break in between. So we had one station after the other, 10 stations altogether, not knowing which one is the pilot station. So whenever you enter a particular room to to talk to your active patient, there are one or two OSCE stations that are there just to see if they want to have this very same question the following year and to be officially keep it as an exam question. So now those are your pilot stations.
Okay.
So even in mine, when I was writing, I had no idea what pilot stations there were. But this is basically the format of MFDS Part 2. And a few challenges that I faced while preparing for these exams were, the first is you actually need to think about two things that really come into mind, is basically both time and money. So the people who are sitting for the MFDS exams, especially Part 2, they come from very varying backgrounds. It can be fresh graduates, they can be people who are practicing in their dental practice from 9 to 5, 9 to 9, work 6 days or 7 days a week. They can be people, have already have family and other commitments, and that is very normal. So if you're going to be writing an exam, such as the MFDS, although it gives you the opportunity and opens doors, gives you leverage into, doing another course, a postgraduate degree, a diploma, a certificate, or any other thing that you feel like propelling you forward in the dental world. I feel like all of these, when it comes to time, they need to really know whether this is something that is going to be beneficial for them before they attempt exams. That is one thing. And as for money, there's a certain amount that you need to pay for your Part 1 as well as your Part 2. So, with the conversion rate and every single thing, you might want to see how exactly it is in your respective country. And the amount is not really little, it's quite a bit. If I'm not mistaken, the Part 1 is about £500 to £600, and the Part 2 is roughly about close to £1,000. So really think about it before you sit for the exams. So these were one of the challenges that I faced that, I felt I really needed to consider before attending these exams.
You were talking about the OSCE stations where you were given a question and you had an actor and you had an examiner and you're supposed to discuss the question you're based on that question.
Right.
Were there any stations where you had to do something hands-on, something like a rubber dam or crown pep or suturing?
So basically, I had none of that.
Okay.
So the MFDS exams is mostly, it tests your communication skills, your interaction with the patients. How well are you able to deliver the knowledge that you have gained in your MFDS Part 1, and how you're able to deliver it to the patients, basically, and how they are able to understand you as you deliver. So this is what you're assessed on. There is no hands-on in your MFDS. So there is no suturing, there's no identifying medications, the medical emergencies, none. Yeah.
Fantastic. And that's it. And did you have to practice something with some other people who are preparing for your OSCEs where you have actors, right? So did you have something similar like that?
Yes. Okay. So for me, I was introduced to a discussion group by one of my colleagues. So I had a discussion group with a few of them, and we used to practice with each other. I actually realized the importance of, when you practice at work, because some people think of taking a break from their work when they're doing the MFDS Part 2 as they're writing the exams. My advice or my suggestion would be not to do that, because what's more better than you practicing on real life patients? So, you can relate it to people who are coming into your clinic, and sometimes you can even test it out on patients to see how they respond. Is this the way or the manner in which you ask the question? For me, I had a lot of practice with all of my colleagues, but the time span or the length that I gave myself to study was extremely important, because I had commitments as well, so I had to work from 9 to 5. So working from 9 to 5 and then coming back home and then studying these exams, which means that I had to plan earlier on that this is how much of time I have to give in order to clear the exams. So that was basically one of it. Yeah.
And is there anything specific, something else you want to add on to whatever you have told for the participants?
Yeah. So there was one other thing, because I came across this quite frequently. Some of my friends have been asking me. So most of them ask, how much time do you give yourself to study for these exams? At the top of my head, I can only think of two things. One is actually the manner in which you study, and the second is basically the commitment the responsibilities that you already have. So the manner in which we study, there are some people who need to write notes in order to study for the exams. There are some people who just read it the first time and they already have it. And then there are some people who put in the extra effort to, they read it first to understand and then they read it the second time to remember. I would say that whichever manner in which you start to study, it doesn't really matter because nothing is wrong. It's just that when you put the effort, let's just say that you're going to write and that's how you absorb information. So maybe writing requires a little bit more time compared to just reading it. So according to that, allocate enough time for yourself to study with all the responsibilities that you already have. Yeah, that's the only thing that I wanted to.
Thank you so much for your valuable time. And is it okay if I can add your email ID so that if people want to reach out to you?
Most definitely.
Or something
Most
like
definitely.
that, always do that.
Most definitely. Yes.
Thank you so much,
Thank you so much, Dr.
Gyaathri, and congratulations once again for your MFDS from Edinburgh, and wishing you all the best for your future endeavors.
Thank you so much, Dr. Vinay. Have a good day.
Have a good day.
Thank you. Yeah. All the best.
All the best.